Hi guys, Lisa Ackerman here, co-founder and executive director of TACA. I'm so excited today. Got Judith Ursitti here and
You
our
got my list
history.
right too.
Oh, well, I did. Thank
Very
you.
good.
I'm trying. I'm trying to get better, but I'm just this is such an important discussion. As friends, we're going to talk a lot about profound autism. And I really want to thank you for your work at Autism Speaks and the Council on Autism Service Providers. That's been all the setup for where you're going. And at Autism Speaks insurance funding, having that for autism families has been a game changer. So I can't thank you enough. Thank you. And then loving what CASP is doing for the therapeutic standards for services to improve the quality of ABA, a lifeline for so many.
Yeah, so needed.
So
Yeah.
and so if I just have to say, like, if there's something legislative, it's probably got your name on it. And you're tied, and I'm grateful because I have such a hard time talking to people in the political arena.
Oh,
Um, but I really want to talk about the new org, the Profound Autism Alliance. I am so grateful you've dived on this, and I want to be a partner and collaborator in any way to help you because it is so important that we address the needs of our highest needs individuals, and that's really my heart. So thank you.
oh, thank you. And there's a reason, Lisa, that we named it an alliance because we don't want to be out on our own and, thinking we're the only thing that matters. It's so important that we're in alliance with our fellow disability organizations, our fellow autism organizations. Like we all need to hold one another's hands to move forward. So that was really strategic. I want it to be an alliance. There's way too much war and faction fatigue going on. And that's, I think, inevitable in humanity, but I really hope we can focus on things we have in common and ways to move forward because people that have profound autism and people who have autism and their families, their caregivers, their providers, they all deserve that, I think.
Yeah, we're 100% in alliance on that one. They deserve the best of us, not our anything but the best. Let's just focus on that. And the rest can go over here for a little while. And
Ignore.
so, you
Yeah.
know, I always like to start off. We all have a story. Tell us your autism story.
Absolutely. So I'm a Texan, through and through. And we were living in Texas, just outside of Dallas, when my son Jack was diagnosed with autism. That was back in 2005. And we were unusual. Our pediatrician actually caught it. She caught it when he was two. And
I may be
she,
shocked for a moment. Just let me
I
be shocked for
know.
a moment. That's great,
Yeah.
though.
Yeah, so she was kind of this really eccentric, sort of hippie, dippy sort of pediatrician. And I'll never forget, we were at his 2-year checkup. I took him on his second birthday, which is so mean. And she was going down the routine developmental screening with me, saying, does he point, does he share things and show you things, does he wave bye-bye, does he, how many 2-word phrases does he have? And for every answer I would say no and no. And as I said no over and over, my heart started sinking a little bit. I was thinking like, wow, this is not good. And it's not like I had been totally oblivious to his development, but I did kind of live in that world where I had my daughter who talked early and, kind of, it was just a different experience. So he wasn't talking yet, but people were saying, like, oh, he's a boy, like he'll talk late or whatever. And so I was like, okay. The second child, kind of like, I think he's fine. But fortunately, our pediatrician, she was on that one of those little stools with the wheels. She wheeled over and we were like knee to knee. And she just looked at me and Jack was sitting on my lap, sucking his thumb. And she said, something's going on. And she said, we gotta figure it out like right away. So he was in for an MRI the next day, which was very overwhelming. And we were at a pediatric neurologist within a couple of weeks. And the pediatric neurologist told me, I remember he left. He spent like 5 minutes with Jack. He left, came back with a little slip of paper. It said autism spectrum disorder on it. And I was just shocked. I wasn't in that mode. I wasn't one of those moms. I'm always so impressed with those moms who were like, oh, I knew what it was. That was not me. I did
Not me
not.
either.
So you judge me. That's fine. I didn't know. Um, and so I'm Southern. So I was really trying not to make a scene and start. I didn't want to cry in front of him or anything, but tears did well up and they kind of just sprung out of my eyes. There was no like stopping them. And I remember he just kind of looked at me and he's like, well, what did you expect me to say? Like, didn't you know? Because it was so obvious. But I really didn't know. I said, no, I didn't know. I didn't know. So he told me, he said, join the Autism Society of America and go to early intervention. So I was like, okay. So early intervention in Texas at the time, and it's not a lot better now, for Jack was 1 hour of speech therapy a month. And then they would send a social worker out to check in on me, to be like, how
Oh my
are you doing?
God.
And I remember thinking like, well, I'm doing fine, but I'd like to help my son, like
Right.
something. It was a disaster. It was just terrible. So he was fortunate that he was diagnosed very quickly because we had an amazingly wonderful pediatrician, um, who was just, she cared and she took the time to see him and really take action. But then accessing services was a whole other ballgame. And that's how I went from being a certified public accountant to being an advocate.
And
So,
I'm sorry that that happened to your family, but I'm grateful that inspired so much change and you had a hand in it. So thank you. And I marvel at our stories. I have an older daughter. Same
yeah.
thing with my son. And he failed his MCHAT at 18 months or 19 months.
Mm.
And the pediatrician just blew it off.
Oh,
It
don't.
was 100% no, 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 no. And I remember looking at my husband in the waiting room going, oh, Jeff failed his first test.
Oh my gosh. Oh my,
So
yeah.
same, but you had a turbo pediatrician and it
I
took
did.
mine.
We got to take action. And so she was like genetic testing, MRI, like everything we can look at. So
Right.
yeah, she was a blessing to us for sure.
So the diagnosis for Jeff came 2 years, 9 months, and it was only because the pediatrician went on vacation and we were in for another ear infection, projectile vomiting, and just a very sick kid. And she had said no the 3 other times that anything is wrong. And the pediatrician that was on duty while she was on vacation was like, well, let's just get a hearing test and a speech eval and rule it in or out. And it couldn't be more in. There was
Yeah.
no, but
Yeah.
me being oblivious, and I feel so bad for boys. Everyone
Yeah.
says they develop so much slower. I feel
Yeah.
really angry that
The
boys
bump.
get that bum rap.
Yeah. Well, and I think too, like we were fortunate that we did get the diagnosis, but then there was just access to services was just because of where we lived at the time, it was very difficult. We ended up having to move across the country. Um, but I think about the time we lost, and we didn't have someone really telling us what to do. Our pediatrician did the best she could, like based on what she knew. But I just always think like what could have been, if Jack had gotten the kind of help he needed early on. So, diagnosis is so important. Access to that's so important. And then immediately after that is access to the right kind of services for that kid.
Right, which that's your career. You've changed everything, the face in those two categories. Thank you. So,
Right. I mean,
well,
there's
you're doing
still,
a great job. You're doing a great job. I'm impressed and grateful. And, you know, the reason why we're here today is to really talk about profound autism. And it's not a very commonly used term, but we want it to be commonly used
Yeah,
because it needs to be available to those who need it and the families who need it. So talk about profound autism.
you got it. So profound autism, it's a newer term. It's been around for, I don't know, 3 or 4 years now. And the reason it was created, for those of you who have tracked the history of autism and how it's defined in this book called the DSM, the Diagnostic Statistical Manual of Mental Disorders. And so in that book, you have everything from schizophrenia to ADHD to intellectual disability. All those are in the DSM. Autism is in the DSM. And autism used to be this massive umbrella of, do you remember PDD and OS and
Asperger's.
the disintegrative disorder and Rett's and Asperger's and classic autism, so it was a huge umbrella. And then there was a movement by self advocates, many of who had that Asperger's sort of label, to kind of collapse it to make it autism. And so the DSM committee on autism, there was representation by those self advocates in the group. And so they did that. They changed, got rid of all the different terms, just created this one umbrella, autism spectrum disorder. And then it really wasn't the committee that wanted to make it level 1, level 2, level 3, but as the different descriptions made their way through review at the American Psychiatric Association, that's how it ended up. So it ended up, you've got autism spectrum disorder, level 1, has some support needs, level 2, more support needs, and then level 3, high support needs. And so they went with that. And that was in the DSM-5. After that, everybody kind of looked around and there was a lot of focus on, well, what's going to happen with the Asperger's people? They're losing that label. But then what was really happening was just the terminology, like high support needs. You started having people from all across the spectrum talking about having high support needs. So you would have self advocates who were college graduates saying, well, I have high support needs too, or I'm level 3 sometimes too. And so there was a lot of fluidity that kind of emerged. So that was a really long, nerdy explanation. So
No, it's perfect.
where
Go nerds.
there was, I know, go nerds. So a bunch of fancy autism research people, some self advocates, people like that, um, created a commission on autism called the Lancet Commission. And they were not just looking at profound autism, they were looking at all sorts of things related to autism. And then they have a list of about 30 things. But their goal was to try to change the reality that a lot of awareness had emerged around autism, but not a lot of really helpful things had developed. So she's really like, okay, we have a lot of awareness, but everybody's still having a really hard time. So they're like, what can we do for the next 5 years to create a change? It's like right now, they can change things in 5 years. So one of those things was to create the definition, profound autism, because they felt like there was a group of people who weren't fluid, who really had lifetime high support needs, lifetime 24/7 care needs. And so they created that definition, and that's why it occurred. Now, there was pushback on that. Some felt like it was too stigmatizing, to acknowledge that certain parts of humanity might have lifetime high support needs or might have some sort of intellectual disability. And people definitely have the right to their opinions. My opinion, being the parent of someone and living with someone like Jack, who is like that, is Yes. I mean, when you test him, he does test with a severe intellectual disability. But I just see that as another form of neurodivergence. For him, that part makes things harder for him in many ways, but it's not stigmatizing. Like, why should it be? Why does that make him less of a person? It just paints the picture of kind of his reality that we see externally. I don't know what's going on internally with him. I don't know. I suspect that there's a lot going on, and there's a lot of times where he'd like to say, Mom, like,
Uh,
come on, like, don't, well, he does, like he has a really good sense of direction for one thing. Like if we go the wrong way, and he lets me know. So I know that he's smart, he's capable, but just by saying people actually have high support needs constantly throughout their lives, the intention is not stigma. It's not to say, oh my gosh, I'm the mom of someone who's severely disabled, feel sorry for me. It's just to paint the picture of who they are so we can help them. And it's just a difference, just like someone who is level 1 and who has support needs that can vary. Their neurodivergence is different. So it's just some clarity there. There will be commonality, but there are also lots of things that are different that we really need to address just so we can do things better. So it's not about
yeah.
it's about clarity. It's about love.
Yeah, I'm so bothered by the word stigma, and as it relates to our kids, if they need support, it's almost like we're doing the opposite of helpful. We're hurting them if we don't give them the support or the families the support they need. And if
Yeah,
we have a better diagnostic criteria that could drive the right supports for each human.
yeah.
So
Why shame attached to that? There should not
I,
be. Yeah,
so I
and it's
just,
yeah.
wow.
And it's interesting too. What's really been interesting to me, especially since we started the organization, I don't think I realized this beforehand. Like I definitely knew there was critique going on in the autism space and the disability space, um, because people they don't like the perceived stigma of saying profound or intellectual disability or something like that. Um, but the other thing too are parents, honestly, and I guess I get this, but I don't know. I'm a weirdo. I come from a family of weirdos. Like my kids are weirdos. Like I never thought like, oh gosh, I don't want to say my son has profound autism because I'm ashamed. Like people might think we're weird or my so some of the hesitation too actually can come from caregivers at first too, where they're like, oh, and I get that. Like you certainly don't want to mislabel a human being,
Oh,
you
no.
know, and the way that the definition is written in the Lancet, um, it says it's not for young children. It's for you need to be old enough that you really know like this child needs 24/7 care. So it's not for littles. You don't say that a 3-year-old has profound autism. You don't
Right,
know that.
right.
So I think that's super important too. But it shouldn't be about shame. It's just about clarity, meaningful help, love and support. That's what it's all about.
So to help folks understand, when should the label profound autism start to be used for an individual?
So, this is a non-scientific comment, but around probably not earlier than 8. And
Okay,
I think the Lancet, they say, like it shouldn't be for young children, and they reference
right.
age above. So that sounds about right. As with everything, it's going to be super individualized,
Okay.
even within the profound autism space. I find it so interesting. um, we had someone commenting the other day on something we posted on Twitter, and they were just saying, like, well, if you parents would just give your profound kids a communication, then you'd realize that they don't have profound autism. And I wanted to come back and say, like, a lot of kids, and adults who have profound autism use different communication forms and devices. Like they do, we do.
Right.
but they're heterogeneous. Like some people are out there typing and some people are not. Like it just depends on the person. And, we really need to think about that. The one thing that they all have in common is just that they need that 24/7 lifetime care. That's it. And then, other than that, they may or may not have an intellectual disability. They may or may not have challenging behaviors. You
Right,
know, like it's just people have a certain perception about like some dangerous person who has no form of communication. And certainly that type of humanity exists as a big part of our community, but it could also be, someone else who's very laid back, but just is not able to ever be left alone because of their high support needs. Like
right.
they're human beings, but they're a category that is increasingly just left out of the conversation.
Yeah, and I find it interesting. So the CDC has been looking at autism since early, like 2000, the first report. And profound autism over the time period from then to now was 27%, but this last survey has it at 32%. Do
Well,
you
and
think profound autism is increasing, or we're more aware, or the kids are at an age where it's appropriate to die? What are your thoughts?
well, now we're going to get down to the nitty
Yeah,
gritty.
let's do it.
Yeah. So what they've been measuring before was actually intellectual disability. And
Okay.
it was like up to like 36%, had what they called IQ below 70, intellectual disability. And that's how they tracked it. So that number um, has increased over time as they're measuring. But then they also did a brand new study in 2023, and this will make your head spin, on profound autism, which is a different thing. It's the thing
Hmm.
where it's like they may or may not have an intellectual disability, but they need 24/7 lifetime care. And so it's a different category than what they had been measuring before. And they found that 26.7% of the spectrum have profound autism. So 1 in 4 people who are autistic have profound autism, which is a new stat for them. It's
Right.
brand new. So, I think that number probably is underreported, just based on the measurements that they had to use, because there's not like a clear scientific definition. All the fancy researchers are debating about what the criteria should be for profound autism. So one thing we're doing at the Profound Autism Alliance, our nonprofit, is we're funding a Delphi study, which
Right.
the Delphi study is bringing together like 300 fancy experts. Fancy is my favorite word, but that's, like they're all the smart autism people to reach a consensus on a definition for research purposes. So that way, as profound autism is being researched, everybody's researching the same thing. Because then that way you don't have this confusion about, well, does my child have profound autism or not? Or is it really 26.7 or is it 40%? Like
Right.
again, it comes back to getting real clarity. So that, is in the works right now. And that definition for researchers will be coming out this year, like in the next few months.
And
So,
I love that so much. But to make a comment, like I feel the reason why, even though we have 50 to 100 abstracts coming out each week on autism, whether
yes.
it's therapeutics, diagnostics, treatments,
Yeah.
whatever, they're looking at the whole spectrum. And if they could do research in these subcategories, we'd be so much further along.
Oh, for sure.
Okay, great. I
For
feel
sure. That
it
is
makes
why
me
we're doing
crazy.
that. Because we really, so I've been going to the International Society of Autism Research, NSAR, their annual meeting. I've gone the last 2 years, and I hated science. Like when I was in high school, it is not.
Too, me too.
I liked English, I liked history, that was but like biology, I just thought I could do it, but it's just so boring. So, but I go to these things and I try super hard to pay attention. I'm always impressed with my mom peers who, like really are into it and get it. I try. But what I do perceive as I'm going around talking to the different researchers is a lot of them don't even realize, like, they're not from the autism community, definitely. Like they're not familiar. So when
Hmm.
you ask them, like, okay, like what type of people with autism are in your studies, like they just kind of look at you like, well, we recruit autistic people. They don't really perceive that there's a difference. So we really want to work to, again, create that clarity and then incentivize researchers to design research that includes people or is exclusive to people with profound autism so that
Right.
you them. They have GI issues, they have seizures, they have, you know, catatonia, like so many things that they're dealing with that are heightened for that group. It's different. So they're not dealing with, that we know of, like suicidal ideation, like perhaps
Right.
people who level one might be dealing with.
Right.
So in many cases, that clarity is so important. And the other thing, too, I'll say is I have yet to see any biological research that shows they're the same thing, even. Like ASD was defined in a book written by a committee. Like it's not based on,
Biomarker.
oh, it's not. So, we don't even know if these are the same things or not. We really don't.
Well, I
So,
always like to say 30 years from now, there'll probably be 30 different labels, multiple biomarkers, and multiple differences
yeah,
versus the slush bucket we call autism, which is just so not helpful. And which
yeah.
kind of leads me to my next point. I don't mean to throw the APA under the bus, but did they really mess things up with DSM-5 in 2013?
Yeah,
Yeah,
I think so. And
yeah,
when you talk to the researchers who are on that committee who really care about the autism community, the way it ended up was not their intent. It
okay.
really wasn't. There was a lot more specificity. And many of those people now, they're working with us to really create clarity around profound autism. And they're not doing it just because they only care about the people who fall in that category. They care about the entire spectrum and think everyone will benefit with clarity and focus in the right directions for the right groups.
So the APA, American Psychological Association, if I had a magic fairy wand, could we bring Asperger's back and profound autism back and then still have the diagnostic clarity for, let's say, the sandwich middle, the kids in the middle or the adults in the middle? I mean, what are your thoughts on what should be done with the APA in the next DSM?
I think based on my conversations, like Kathy Lord leads that group, and conversations with her and others who were involved, they change it, once a decade or so. So they hear from people. Right now, they're tweaking things as they can, like with footnotes and things like that, addendums to the DSM-5. That's what you're going to see for a while. So this is an ultra marathon. I think because of the friction in the community and with the emerging research that you're going to see when you have this clear administrative term for research purposes, they will end up creating clarity. But that's why it's so important right now that we create this research term so we can say, look, like we've isolated people who need 24/7 care throughout their lives. We've focused research on them. This is what's happening with them. This needs to be reflected in the DSM. So it's step by step by step, that we'll get there. But for people who are thinking like, oh, let's bring Asperger's back like in the next couple of years, I don't think that's going to happen. Like, I don't. But I do think the next iteration of the DSM, whenever that is, you're likely to see changes. What's interesting too is it's not unique to autism. Like there's
Right.
a by Andrew Solomon, it's called Far from the Tree.
I
And
love Andrew Sullivan.
yeah, so he writes about schizophrenia, he writes about criminals, like parents of criminals, like parents of the Columbine killers, people
Right.
that he writes about the deaf community. There's division and derision in those groups, like in the world of schizophrenia, like people debate about the various categories of schizophrenia that are in the DSM. So all that stuff is going on, it's not just us. So we have to find methodical ways to get the people, that are psychiatrists, and live in the ivory towers to really see what's happening in the real world. So that's what we're trying to do with the research that we're doing. So
Can we
it's
have
hard.
the psychiatrists and the APA live with a family for a day in
I
each of
know,
these categories? I think that would make them such better
for sure.
in their view and what's
Yeah.
happening.
Yeah.
Sorry, I'm going to just say it and hope from my lips to God's ears somebody's listening to that.
It's, well, yeah, wherever two or three are gathered, here we are. So
Right,
I'm
right.
saying it too.
Well,
Yeah.
for me, humanity expects us. I mean, we're judged by how we take care of our highest needs individuals, and we have so much work to do, not just in autism, but anyone who falls in the DSM deserves more respect and clarity, so we
Yeah.
can be better at making their lives better.
Yeah.
Yeah, I love this talk. I really hope we get an opportunity to see that change. So the clarity in the diagnostics will really make a big difference.
Yeah.
So that's
Yeah.
number one.
Yeah.
Let's transition to the federal government. They're not off the hook. What are they doing to help the autism community? Forget everyone else for a minute because we're going to focus on us.
Okay.
What do you think they're doing?
Not enough. So,
I was going to have a banner fly by me and say,
well, the fact that
nothing.
I have been told by multiple DC lobbyists and
Mhm.
leaders of autism advocacy organizations that when I'm in Washington, DC, I cannot use the term profound autism. You cannot say it. You can't say that.
What?
It's
Why?
too offensive. Like it's too offensive a word to say. So I
Do you
am
have
not
t-shirts yet? Do you have t-shirts yet? Stickers, pens, hats?
right. So I mean, I'm not a rabble rouser, really. Like I vicariously like let other people rabble rouse, and I'm like cheering them on. So, but that's just absurd. Again, because they talk about how the disability community, the broader disability community doesn't like that term. They think it's stigmatizing. It's not. It's just a word that describes a presentation, and it doesn't mean that we're not presuming competence. It's just a different kind of competence, right? We're not
Right,
the same. I am not Steve Jobs. Like if I was, I'd spend all my Steve Jobs brain time fixing autism and helping people, but I'm not Steve Jobs. I'm me. So we all have different levels of competence. We have different strengths and weaknesses, but anyway, so there's just been this movement towards not saying it. So if you go through and if you look at, for example, the Interagency Autism Coordinating Committee and the publications that they have, like go into the little round search window and search the word profound. Go to the Autism Society of
oh,
America. Go to the Autism Society of America and search for the word profound on their website, you know, or Autism Speaks. So I checked on Autism Speaks this last week and they have more. Like it's more, it used to be nothing and now it's more. And I will say their chief science officer, Andy Shee, last year at his keynote at NSAR, he talked about profound autism. So
good.
ops. But the federal government, the committee that coordinates all the autism research and supports and services, they don't use the term. Although they're going to have to, because I went to their last meeting, and at their last meeting, they were talking about their year-end summary for 2023 and like the biggest research studies for 2023, because they're coming out with this publication. And so one of the studies that they're highlighting, like their top 10 studies, is the CDC study on profound autism, saying that 26.7% of the population has profound autism. So whenever that comes out, like you're going to see that on my website everywhere, like they're saying it's like profound autism. So we're getting there, but they're very hesitant. They like to say things like intense behaviors or severe challenging behaviors. But like I was telling you, that's the stigmatizing thing. So you're saying every human being who has
With
profound autism has severe challenging behaviors. Not that that's a bad,
no,
but like, no, they don't actually. Like, it's just, it's ridiculous.
well, God
So
bless you for going to the IACC and the INSAR because I I have to be honest, I got allergic to them at least 6 years ago.
yeah,
I will circle back. I will re-engage. I needed a little break
yes.
because I found it completely upsetting how things were being sugar coated and ignored.
Gosh.
And I've yet to find someone, not one family. When I go to a conference and I present, I always ask how many new parents, how many it's your first conference, and how many know what the IACC is and the interagency coordinating. It's maybe 5 hands out of 1,000 that gets hand up. And then
Yeah,
my next question is always, okay, what for the families that raise their hands, they know that IACC, have they helped your family?
yeah,
I have not found a family. So TACA serves over 90,000 families across the United States. I'm still trying to find the one family that has been helped by the IACC.
yeah. It's
Um,
free. And it's interesting. There are members of the IACC who really do want to help,
I know that,
but they
but I
get
just,
they get shut down. They really, there was one, I won't name names, but they really wanted to do additional research on communication. There's not a lot of research out there on
right,
communication. It's so
right,
needed. And they were just told, we've already done that, move on. We're not talking about that, which is absurd. Like, come on, we need all different types of communication. And the research is so important. So that way, if it's valid, and you can make sure that people who are helping provide it know what they're doing. So
right,
research is critical on communication. And what happens in the vacuum, of course, is people are just going to do what they can do. So if you want to find real ways to help people, then let's do research on communication. The community is desperate for it. So anyway, there's the IACC, but we have been through Profound Autism Alliance facilitating a lot of public comment. So we're in
great,
there.
great.
And, it's all about sharing stories and realities, maintaining the dignity of people with profound autism, but sharing those realities so they're constantly seeing that. So we've been doing that. And then I go to the meetings. And then the other thing I'm doing is just trying to advocate on the big mama piece of federal legislation, Autism Cares. Autism Cares funds all the research pretty much at the National Institutes of Health for Autism and all the stuff that goes on, the interagency coordination, the prevalence studies, the Lind fellow, all that stuff goes through um, Autism Cares. So we have been advocating. I was just in Washington, D.C. yesterday,
Thank you.
meeting with members of the subcommittee on health at the Energy and Commerce Committee in the House. That's where the bill is right now. And my goal is just to talk to them about profound autism. And I talked to them about how we were talking about when Jack was diagnosed at age 2, 2005. We were in Texas, my home state at the time. And right around that time, Rick Santorum was authoring the Combating Autism Act of 2006. And so there was a congressman from Texas named Joe Barton. I don't know if you remember this, Lisa.
Yeah, that you're bringing back
He,
memories.
he was blocking the bill. He was the chair of Energy and Commerce, and he was like, "We're not going to have this bill." And so a bunch of us from Dallas,
Mhm.
many of whom you know, made up our little posters, and like we went everywhere he was, and we're like, pass the Combating Autism Act, save our kids. So that was my first piece of like federal advocacy I ever got involved with. And the bill did pass. But at the time, it was all about funding research to try to find real change for autism. People were seeking a cure, at that time. And Jack was just a little one, and I had a lot to learn. We all did. But fast forward to today, he's 20 years old. I'm the same age that I was in. But you really look at where we are now, and only 6% of the research, the clinical research that's done through Autism Cares, it's called Autism Cares now, it's not the Combating Autism Act anymore. Um, Only 6% of the research includes people with profound autism. Like we're not even a drop in the bucket. So if you're not included in research, how are they going to help you? They're
And
not. So I'm going to the members of the committee, and right now the bill has been filed, and it's just a straight reauthorization of what has already been in place. So no change. Like we're still going to be over here in this little 6%. And, we're kind of being told by everyone, just don't mess things up. Like, don't, because it's a difficult political climate. You don't want to upset the apple cart. Like, shh, don't say anything. But how can I not? Like, how can we not? So I've been
well,
going,
you have me to go with you. I'll go with you. But talk to
yes.
me. Let's
So
talk about that's such an injustice. Can I ask you, is there anything in Autism Cares reauthorization that's going to help families directly?
so there is a little bit of training for medical professionals. So they're trying to do training for doctors, nurses, medical professionals, so they know how to care for people like in primary care, like so, but it's not in depth, like really truly understanding the biology of autism. It's just having an awareness because they're not teaching it in medical school at all. um, but having an awareness of like you're going to have patients who have autism, how do you communicate with them, how do you communicate with their caregiver, so that kind of stuff. But it really stops at that, and then the prevalence work is still of course being done at the CDC. But that's really it. There's of course the biological stuff, the genetic stuff, all that continues. The clinical stuff is very much around more of the neurodivergent identity, gender fluidity, like moving more towards that kind of research. So there's none around, or very little around, like severe challenging behavior. We were talking about communication, like those sorts of things. And everything looks at autism very broadly. So when you're looking at studies and you think about who's represented, they're measuring things like socioeconomic, race,
Mm-hmm.
gender. They need to start measuring whether or not it includes someone with profound autism. So anyway.
Well, I'm going to be so bold to say the IACC, NSAR, and Autism Cares. I really haven't seen a return on investment for their efforts at this point. And I
I agree.
feel families are left out in the cold. There's nothing in there for caregivers and families. That has to change.
It does.
That
And
has to change.
it does. And so Autism Cares is a research bill. It's, in the NIH. But what they can do is really research things to figure out, like, okay, we need to have day services for adults, that they can go to and be safe and happy. Like,
Right.
so what works? How do we fund those? Like, you can do research around that so that you can establish programs, right? To see what works, but they're not even doing that
That.
kind of baseline work.
So
So
for the time, the minimal time compared to you, Judith, you do so much more that I've spent with political representatives, whether state or federal. They always push me to the IACC or the Autism Cares Act, saying that's what we're doing to help. And I want to scream for the mountaintops.
yeah,
No ROI and
yeah,
no
no,
help for families. What
no.
we have to find a way to craft what we can do. And again, you're my friend. We're talking. And it's not your fault. It's
Oh,
how do we get people to care about families living with autism today to make a difference? And that's where I sit. These poor
yeah,
people are not being taken care of. And again, not directed at you, but what do you suggest?
no,
How do we change that paradigm to
yes,
have families be part of that solution?
yeah. So yesterday I was meeting with all Republicans, the committee, um, because what I learned in working in many, many states on insurance reform is, well, in many states, the Republicans are in charge, not to get partisan, but there's a lot of red states in this
Yeah,
country.
yeah,
Um, and what I know about Republicans, having grown up in Texas, is you have to make the fiscal argument, right? So they're just, if you can show them how this is going to help their budget, then because they've got lots of people coming to them with different problems. We're not special. I wish we were, but we're not. So, but if you can make the fiscal argument, so that, those are the conversations I was having yesterday. So when I was talking to some of the Republicans yesterday, I've been busy this week. The day before yesterday, I went to lunch with a researcher who's like an MIT mathematician genius named Matthew Goodwin. Do you know Matthew?
I've
Uh,
only on paper, don't know
okay.
him personally.
He's doing work right now that I don't really understand around biometrics.
Okay,
Um, and so, very simplistically, um, over the last couple of years, my son Jack has been biting his tongue. And he's not just biting his tongue on accident or nicking it. Like it's a horror movie, horrific, bloodletting, brutal behavior. Like he will bite down on his tongue and hold it. You can't clench his mouth open. It's very traumatic. And we've tried to figure out like what's going on, how to stop it. Like it's no one knows what to do. It's just a very hard thing. He lost 20 pounds because his tongue was so damaged that it was hard for him to eat. So these are the realities of people with profound autism, right? That is the population. There's all sorts of weird stuff like that going on behind the scenes that people don't talk about, you don't see. And so with Dr. Goodwin, the kind of research he's doing is he could put a sensor on Jack and know 3 minutes before he bites his tongue that he's going to bite his tongue based on his heart rate, his body temperature, different factors,
right,
biometrics. And he was talking to me about how the goal is over time to be able to put things in place to prevent the damaging behavior. So you could be like, Alexa, turn on the lights, or something that makes him stop doing it or distracts him. So, and even with Alexa, like you wouldn't even have to say it out loud because Alexa would be plugged into the
right,
biometrics and they would know, oh, time to turn on the lights because that's going to make Jack not bite his tongue. Like, so that sort of thing, like if you can get research like that funded, that's real time, we can help right now, then
right,
someone like Jack doesn't have to go live in some 24/7 institutional placement that costs millions of dollars. Like you keep people in the community, in their homes, healthy. He can eat because he's not biting his tongue. So these are the short-term fiscal benefits. So that's how we convince legislators. Like you can tug at their heartstrings, and for some, that will move them. But to get them to really move, you've got to make that fiscal argument. So the Republicans perked up when I was talking about the math and how it was mathing and how, you know, this is actually something that could save you money and help someone at the same time. So that's how you have to do it. Um, and the other thing we have to do too is we've got to get some action going outside of those research bills.
Right.
Think about,
Please.
yeah, and it's can't just be private insurance. Like we're done a lot of work on private insurance, and there's tons of protections under mental health parity law too that can help people. But we really have to advocate for Medicaid services for people that do need that lifetime 24/7 care. In
Yeah.
my state of Texas, the waiting list, this is
Oh,
not an exaggeration, is 15 years
right.
long. And if you're in some crisis, which basically means everyone's dead and there's no one to take care of the person, then they might move you because of a crisis. But it requires death. Like it's absurd. So we really have to advocate with CMS, the Federal Medicaid Agency, to say, like, this population exists. So again, it goes back to, I'm nerding out here, creating that research definition. But if you
Mm-hmm.
that research definition and you say, like, listen, we've done specific research on your fancy research definition of profound autism, these people exist, they need XYZ, you need to fund this, like move them to the top of the list. So all that kind of works together federally. And that's the part we were talking about, like super communicators and trying to figure out how to communicate to people. When you talk to someone about saying, like, oh, well, we're clinician, they just look at you like, oh, wow, great. That's really going to help me. Like, I haven't left my home in 3 months because my loved one with profound autism can't leave the house.
Right.
Like, it's not helpful. So, those are the big picture things. And then we just have to figure out how to create awareness, supports, and services for the suffering, the challenges that are going on right now.
Right. The individual and the family, the siblings. I mean,
Oh,
my gosh,
yeah.
they definitely, but I would be remiss if I didn't, for our Republican friends listening, the
Yeah.
ROI is 4 to 9 times ROI when you invest in early intervention for an
Yeah.
individual. You can
Oh,
improve IQ points by 30% if you
yeah.
could get a kid before the age of 2 into
Yeah.
early intervention, which could change the trajectory from special education, high needs to regular education.
Yeah. It's a
Um, Still in
difference.
the spectrum, but let's talk about it, Republicans, taxpayers. We
Yes.
want taxpayers.
Right.
So
I'll
I
never
would,
forget. Yeah.
sorry, I know you know that, but for
Yeah. No,
anyone
but
who's listening, I want to share.
yeah. I'll never forget. I was at a hearing in Maryland and we had a self-advocate who was testifying for our autism insurance bill there, and he brought his tax returns. And he talked about how his parents had paid out of pocket for his early intervention and for his supports and services through the years. And he brought his tax return. He's like, I have a job now. It was so powerful, to see
Yeah.
that.
Well, I
So
mean, to talk about Jeff for a second, he had his first anniversary with his job, and they got him a cake and a
that's so
card and celebrated him. He was so proud being able to work and do that.
yeah,
And I
right.
just want people to live their dreams and to feel like an important part of society. We need all these members to be the best health, the best place, and we will have a return on investment
We
that will be
will.
impactful. So let's pivot to the funnest topic ever, the presidential election cycle. How do we get them to give, 2 cents,
Yeah.
whatever candidate? How do we get autism to the forefront, even though there's a lot of problems in the United States today? Still the greatest country, still would love to live here versus anywhere else. But how do we get the
So there
presidential candidates to look at this?
Yeah, so they create their campaign platforms. And, through the years, we've worked really hard to get different candidates to include autism in their platforms. Um, and now they do, but then you go and read it, and like the last time around, it really was all focused on neurodiversity, and it wasn't really focusing on the needs of the autism community that really needs research, interventions, supports, services. So as this campaign season it's in full swing now,
Mhm.
building relationships, showing up at the town hall meetings, which seems absurd, but the representation really does make a difference. So there are efforts going on right now by national autism organizations to get into the platforms, to write the platform about autism. That happens behind the scenes. So it's just who's got the pen, who's driving the narrative. And you're not going to drive the narrative if you just stay home and throw your hands up. And that doesn't mean that everyone in our community can or should be going to all the town halls, but we definitely have to have a group of folks who are going to do that. So folks from TACA, we're at Profound Autism Alliance building a profound autism advocacy network. So if you want to be one of the leaders in the network who is going to be more engaged, who will go to campaign events or town halls and will submit questions, that's how we do it. We just got to put in that effort. And it doesn't have to be the caregiver. As you mentioned earlier, Lisa, siblings,
Yeah,
so much to say, you know,
yeah,
or, grandparents, people in the community, friends, but people who are willing just to stand up and say, this group is falling behind. This is the United States of America, and we have a population that is just being forgotten. So,
completely. Yeah.
yeah,
I love that. And for families listening, rather than getting upset, get empowered and go to these town halls and bring a neighbor or bring your sister or brother or the siblings to get up and talk and just be
yeah.
heard. That's a
It
great set of
is,
advice. We've had the presidential candidate, kind of mission statement for making their autism platform, and it's 15 points. And we've had it, gosh, I want to say since I think 10 years, maybe even longer. Time flies when you're having fun. Um, but yeah, we need some heroes in this community. And back
yeah.
to my Republican friends, you have an ROI if you get involved, and you make a difference. So,
Yes,
and for my Democratic friends, you save a life. So let's do this. Let's
that's
do
right.
this. So, well, there's so much more, and I've got a few more questions because I could talk to you all day, but also want
Yeah.
to make sure that I respect your time. And that kind of hit, what do we miss out of all of this? We gave families some tools. We told the APA what they should do. We share with the federal government their missing care for families living with autism today. What do we miss?
I mean, I think a couple things. One is, well, it's really all kind of boils down to one thing, and that is really authentic awareness about what profound autism is in the community. So I said this a few times, but I want to say it again. Like, profound autism is an autistic person who requires lifetime 24/7 care. And it's going to look really different. Males, females, communicates, doesn't, but it's just that lifetime 24/7 care thing that is the key. And one thing that we're trying to do at Profound Autism Alliance is pull together stories and pictures that tell that reality. And we want to do it in a way that really recognizes the humanity of the person. So we have something called the Dignity Project. Um, and you can go on our website, profoundautism.org, and you can send us a picture, or you can send us a few words, or if you like to write, you can write something really long. But we just want to share stories. And we've got a wonderful writer working with us who's going to be, just ongoing, pulling all that stuff together and sharing those stories. So the world really understands that autism is so much more than the Big Bang Theory or
Right.
cousin who, just got his driver's license, and all that is wonderful. But there's more to it. Like, there's more to the population. And for me, we talked about this before too, Lisa. Like, I want to be super careful about respecting the humanity of people. Like, I'm not going to post a photo of Jack in the middle of biting his tongue. That's a really hard moment for him. I do want people to understand that that horrible stuff happens and that we're desperate for help, but I want to do it in a way that doesn't invade his privacy or his, I, I always think about like people don't like to admit this, but I have had many moments in my mothering where I have lost my temper and yelled at my kids. Like, you know,
Same.
and I would be so ashamed to have that a video of that like circulated everywhere. For me, that's just like a bad moment, and I'm human. Like, so I think about that. Like, I don't want that put out there. And I
Right.
just want to be careful about what we put out there about people with profound autism. I think we need to think about that. And if you really feel like you have to message about aggressive behaviors or self-injury, I think you can do it in a way that protects their identity. You don't have to, you can do it. So for us, we really want to be authentic, share those realities. So then that way we can get people to care and do things, but also do it in a way that really respects people with profound autism.
And
And the
this is,
I'll say is super exciting. So we're having a profound autism summit.
oh, yay. Thank you. Yeah.
And I think it's going to sell out. Like I cannot believe the response we've had. Because you think
Right.
about families, these families, Lisa, they can't
Mhm.
get out of their house. But so we decided to do this, and I thought, God, we're gonna have like 20 people because people can't come to this thing. But we have right now, like we have like 450 people coming from 32 states. Like, so
Great.
it's our first foray into this. And it's like a month away. So I'm very excited that people are going to have the time to connect and in person be together. So hopefully we can continue to grow that, and give people a place to go, share experiences, share knowledge, and just be together. So that's coming too.
Oh my gosh, the Dignity Project, the conference. I'm so grateful for everything that you're doing, truly. And I
Which is
know, again, if we can get diagnostic specificity and the Delphi Fancy Project and some people to care about parents and what they're experiencing and opening doors for caregivers, help, and then early intervention, but also on ongoing intervention, that would be fabulous. But let's talk about like something fun. Like, where should we be in the next 5 years? What do you hope if you had a magic 8 ball or
um,
Karnak? Remember Karnak, Johnny Carson? You would hold the
oh
envelope and then
yeah,
yeah.
a
The young
turban.
kids, yeah, the young kids don't know who that is. Look it up on YouTube. It's very funny. But
In
where do you
five
want
years,
to be in 5 years? Yeah.
I'd like to see um, specifically funded research for profound autism, funded through the NIH, specific allocation of funds for not only research, but for specifically designed supports and services in the Medicaid space and in the special education space. One thing we didn't talk about, Lisa, was I think that there are uncounted thousands, tens of thousands, hundreds of thousands of people in the profound autism community who have had no choice but to pull their kids out of public school and
Right.
home them. They just homeschool them because it's not safe for them to be at school. And there's nothing for them. So we have got to find a way to help these people. Like these kids are either expelled or they're wandering away from school and they're not safe and their families just pull them out and they take on that whole burden that is supposed to be served by the school system. And it's so uneven throughout the country, as you know, like living
It
outside
is.
is quite different than living outside of Dallas or Tulsa or North Dakota somewhere. So again, with a scientific definition that we can use for educational purposes too, to design supports and services, train providers so that they know what to do and they're paid appropriately to do it. Those are all the things that could be accomplished in 5 years if we can just get the appropriate recognition.
Get people to care. Well, you've got a partner forever. I appreciate what you do.
Yeah.
I really do. And I know that I've got to get back in the game. Got to get back in the game on the federal side. It really
Yeah.
turned me off for a long time, but I'll go
Washington.
back with you.
Yes. You know, now is, back in the day, like, running around with Shelly Hendricks, like in DC,
Yeah,
like the 3-inch heels. Now people got their tennis shoes on, like it's all good. So you can look really cute, but still wear your trainers. Like it's all good. So
wonderful.
Washington Wednesdays, if you ever want to come, the invitation is open and you will walk away. I walked away yesterday feeling seen and heard.
Oh,
But it requires though, so when you're there, you see like the different groups flying in with their little t-shirts. They're there once a year. They're like, oh my gosh, I'm so fancy. I went to the hill. But then they go home and then they just come back in a year. I'm trying to be there every week, so that I'm looking at them and saying, like, listen, I'm just a mom. I'm not out there playing on the golf course with you or whatever, but we're still around. We're not going away. So the more of us, the better. So join me on Washington Wednesday. Let me know when you're coming.
well, we'll figure out a date and time. I'd love to get out to your conference as well. I think it's so
Yeah.
important what you guys do. And just knowing that you have my support, I just really want to shine a light on where help is needed in a very respectful, caring, loving way, just so people don't feel left out.
Mm,
There's so many families that tell me, Lisa, I don't feel like I'm in the number because my son's not in the school or they're not in the Adams survey yet. We want families to feel loved, cared, and supported, which in result helps the individual. So,
yeah,
hey, I could spend 2 hours with you. We got through most of my stuff, but maybe we'll come back and circle back with
I
some newer
know.
updates. So
Yeah.
thank you.
Thank you, Lisa. I appreciate
And
the opportunity. As I said, you're the only person I'm talking to. So
I feel so special. Well, you're
you,
special, and I love what you're about, and just know that we're here to support each other and the families and the individuals living with autism. So God bless you. Godspeed. Go get them, Tiger.
all
Back
right.
at you.
Okay. See you.